Hi, thank you for watching Digging to China. I'm Dong Xiong. For 90 years straight, the US's age-adjusted death rate dropped from what it had been 10 years earlier, indicating long-term improvement in Americans' health. But in 2020, the trend reversed. The 10-year measure rose by 82 deaths per 100,000 due to the COVID-19 pandemic. It is big enough to set the US's progress back by nearly 2 decades. This increase was only topped by the 1918 flu pandemic when looking back at the past 110 years. The death rate in 1929 also topped the decade earlier level, a time when infectious diseases often caused big yearly changes. Deaths from the COVID-19 pandemic are causing an extraordinary jolt in the US, inflating the nation's death rate to the highest level seen in nearly 2 decades. Whether the US will quickly snap back to pre-pandemic levels remains to be seen. Daily COVID-19 deaths are on their way back down, but the disease is unlikely to disappear, and the health experts say these could also be long-running effects from issues like missed cancer screens, a surging rate of drug overdose, and health inequities exacerbated by the pandemic. The US's age-adjusted mortality rate shot up by about 16% in 2020 from the year before, according to provisional data from the Centers for Disease Control and Prevention, marking the highest point since 2003. This also broke a 90-year streak in which the yearly death rate was always lower than it was 10 years earlier. Suddenly, a communicable disease became the third leading cause of death in 2020, trailing only heart disease and cancer. It is the highest level that deaths from infections have ranked in 83 years, marking abrupt changes to patterns of how long people live and how they die. COVID-19 vaccines are already tamping down US infections and promise to restore some normalcy. Some researchers think the death rate will return closer to pre-pandemic levels, perhaps as soon as next year, because it takes significant changes to shift the trends in a nation of 330 million people. Yet, health experts say COVID-19 may also cast a long shadow. As more people died during the pandemic, life expectancy fell. Provisional CDC data show. In the first half of 2020, the agency estimated that the US life expectancy at the birth had declined by about a year since 2019 to 77.8 years. The agency hasn't released the full year data, but the impact is expected to worsen. CDC records going back to 1900 show influenza, pneumonia, and tuberculosis often ranking among the top causes of death early in the century. Improved hygiene and sanitation, treatments such as antibiotics, and the widespread use of vaccines eventually drove down infections and deaths, and Americans began living longer. The focus started to shift to more chronic conditions such as heart disease and cancer. Falling smoking rates, other prevention, and new treatments helped improve Americans' health, and the big swings in the mortality rate became more rare as deaths from infections generally become less common. The HIV epidemic disrupted this trend when it emerged as a high-ranking cause of death in the 1980s and the 1990s. Then came COVID-19. Which the CDC has linked to about 384,000 deaths in the US last year, and which expected an even steeper toll when accounting for excess deaths or deaths that exceeded average from recent years. A combination of deaths that weren't properly attributed to COVID-19 plus collateral damage from issues like people avoiding hospital trips for other health problems are part of the pandemic's true toll. As with non-COVID-19 deaths, the surge in excess deaths has hit communities of color particularly hard. According to CDC data, about 1 in 3 deaths among Hispanic people in 2020 were excess deaths, or those exceeding recent average. About 1 in 4 deaths among black people were excess, and about 1 in 8 among white people were excess. Black men lost 3 years, pulling their life expectancy at the birth down to 68 years, the CDC said. For white women, the loss was 0.7 years, pulling their life expectancy to less than 81 years. The pandemic's enduring effect could include health implications for those who lost their jobs or complications for people who weren't able to care for their chronic medical problems during the pandemic and are now more exposed to potentially serious complications, health experts say. New survey data from the American Diabetes Association show nearly a quarter of adults with diabetes reported challenges managing their blood glucose during the pandemic, and 17% reported developing new complications such as high blood pressure and heart problems. Poor disease management can lead to serious health consequences, including kidney problems, nerve damage, and amputation, said Robert Gabby, the association's chief science and medical officer. Meantime, screenings for breast, colorectal, and prostate cancers were also pushed back as COVID-19 took hold, particularly in the earliest pandemic months, raising another long-term risk for those patients. One recent study in JAMA Oncology estimated that there were 9.4 million missed screens for those cancers in 2020 across the U.S. In 2014, the National Institute of Allergy and Infectious Disease, the NIH arm that Fauci heads, awarded a $3.4 million grant to the New York-based EcoHealth Alliance, which aims to protect people from viruses that jump from species to species. The alliance has projects across 30 countries, including Thailand, Vietnam, and China. The group hired the virology lab in Wuhan to conduct a genetic analysis of bat coronavirus collected in Yunnan province, about 800 miles southwest of Wuhan. The research was considered crucial in part because coronavirus had previously emerged in China and begun to spread among humans. EcoHealth Alliance paid the lab close to $600,000 over 5 years. The lab had secured approval from both the U.S. State Department and the NIH. Dr. Fauci has advocated for gain-of-function research in the Post. In a 2011 article he co-wrote for the Washington Post, he promoted it as a means to study influenza viruses. All parties involved in the grant to the Wuhan Institute of Virology have denied that it involved gain-of-function research. The grant was approved in May 2014. 5 months later, the Obama administration announced it would not fund the new projects that involved gain-of-function research, citing safety and security risks. Though there is an exception in the moratorium that allows it for research urgently necessary to protect public health or national security. Early in the pandemic, the consensus among public health experts was that the COVID-19 coronavirus evolved naturally in a bat and jumped to humans through an intermediary species. But since then, amid calls by Fauci and others for deeper investigation of what happened in China, scientists have publicly raised questions about whether a virus was collected at the Wuhan lab and then escaped. Those questions remain unanswered. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly.